Signs and symptoms. Each person with Down syndrome is an individual. Intellectual and developmental problems may be mild, moderate, or severe. Some people are healthy, while others have significant health problems, such as serious heart problems, flattened face, small head, short neck, protruding tongue, upward slanting eyelids, also known as palpebral fissures, unusually shaped or small ears, poor muscle tone, broad, short hands with a single crease in the palm, relatively short fingers and small hands and feet, excessive flexibility, tiny white spots on the colored part or iris of the eye, called brushfield spots, short height. Infants with Down syndrome may be average size, but typically they grow slowly and remain shorter than other children the same age. Intellectual disabilities. Most children with Down syndrome have mild to moderate cognitive impairment. Language is delayed, and both short and long-term memory. Diagnosis. Healthcare providers can check for Down syndrome during pregnancy or after a child is born. There are two types of tests for Down syndrome during pregnancy. Screening tests can indicate the likelihood or chances that a mother is carrying a baby with Down syndrome. But these tests can't tell for sure or diagnose whether the baby has Down syndrome. Diagnostic tests can identify or diagnose whether your baby has Down syndrome. Chromosomal testing of maternal blood. A pregnant woman who is at risk for having an infant with Down syndrome also can have a chromosomal test using her blood. A mother's blood carries DNA from the fetus, which may show extra chromosome 21 material. A more invasive test then would usually confirm the blood test. Diagnosis of Down syndrome after birth. A diagnosis of Down syndrome after birth is often based initially on physical signs of the syndrome. But because individuals with Down syndrome may not have these symptoms, and because many of these symptoms are common in the general populations, the healthcare provider will take a sample of the baby's blood to confirm the diagnosis. The blood sample is analyzed to determine the number of the baby's chromosomes. Treatment. Down syndrome cannot be cured. However, early treatment can help many people with Down syndrome to live productive lives well into adulthood. Children with Down syndrome can often benefit from speech therapy, occupational therapy, and exercises to help improve their motor skills. They might also be helped by special education and attention at school. Some of the medical problems common in people with Down syndrome, like cataracts, hearing problems, thyroid problems, and seizure disorders, can be also treated or corrected. It has been suggested that children with Down syndrome might benefit from medical treatment that includes amino acid supplements and or some other drugs to improve the ability of the brain to learn and understand.
With the overall goal to help these children develop motor skills, language skills, social skills, and self-help skills that encourage the highest level of function. The following patient is using an obstacle course in this treatment session to facilitate basic sequencing, direction following, gross motor coordination, and functional strength and endurance. Oftentimes, the obstacle course will incorporate movement such as spinning, as in this treatment, to increase the child's sensory arousal level, which in turn increases the patient's personal motivation to participate. Incorporating more learning-type tasks, such as a puzzle or a writing skill, is one way to break up a difficult task with more fun activities, which increases the child's ability to learn new skills. Even though a child may need coaxing, you will notice personal patient satisfaction in the completion of difficult tasks. Using visual stimulating toys, such as a spinner, are great ways to enhance coordination and strength of thumb muscles. Using fun tongs to pick up small items addresses visual motor integration and hand strength. Functional strength and coordination of thumbs and hands are needed to facilitate participation in fine motor activities such as cutting, writing, dressing, and feeding oneself with a spoon and/or a fork. Use of a puzzle to facilitate visual perceptual skills, visual orientation, in-hand manipulation, and playing at midline are all skills required for coloring and writing tasks. This puzzle is a nice warm-up for visual attention to increase success for the next task. This writing task utilizes tactile cues, such as the raised borders, to increase visual awareness for borders and outlines. And this increases patients' independence for tracing and copying shapes.
I want to bounce on ball. I want bounce on ball.
And then press that.
I want bounce on ball.
Okay, let's get. Do you want to get the ball to bounce on?
Yeah.
Oh, let's get that. It's over here. Delays in language skills can be very frustrating for many of our patients. However, using language strategies such as pictures and communication devices increases patients' social interactions and personal language skills.
I want bounce on ball. I want bounce on ball.
Very good. Okay, get on the ball. Here's your ball.
Yeah, that's it.
You're welcome.